and Davao by June this year. To rapidly complement the increase of available beds in NCR, DOH has redeployed a total of 136 healthcare professionals from other regions and continued to provide funds for emergency hiring in the DOH and regional hospitals. We have downloaded at least 348 million pesos to Metro Manila DOH hospitals, specialty hospitals, and other DND and LGU health facilities for the HRH emergency hiring, covering their salaries and benefits for the period of March to June 2021. Hiring is still ongoing, and we strongly encourage interested healthcare workers to get in touch with their CHD and join our growing medical team. We would also like to assure all our healthcare workers that the DOH is sparing no effort to ensure their welfare. And as of March 25, more than 1 billion pesos have been downloaded to Metro Manila and DOH hospitals for the benefits of the healthcare workers, and more than 500 million for the hospital's provision of accommodation, meals, transportation, and insurance of healthcare workers. We are also continuously providing personal protective equipment to ensure that our frontline workers have sufficient supplies. As of writing, about 2 billion pesos worth of PPEs are to be procured through the PSDBM. We are also closely monitoring the infection rate among healthcare workers. We reiterate to hospitals that DOH has set guidelines on testing and quarantine for healthcare workers, and compliance is of utmost importance to not only protect our frontliners, but to also ensure that hospital operations are unhampered. Care does not start and stop within our healthcare facilities. However, our Bida Solution Plus remains to be the first line of defense against the virus. And we call on all public and private establishments, all our communities and households to join us in implementing the minimum public health standards. And part of our ongoing campaign also focuses on boosting vaccine confidence. We assure the public that the vaccines procured have undergone stringent safety and efficacy reviews. Let us all do our part in making our recovery a reality by availing of your vaccines, given free of charge, at your local vaccination sites, and properly waiting for our turn in accordance with our prioritization criteria. Let us all be part of the Bida vaccination. Moving forward, currently, the Philippines has administered more than 1 million COVID-19 vaccines among the priority groups. The DOH expects the vaccination program to speed up once we receive procured vaccines around May 2021. The national vaccination program will continue to expand through engagement with the private sector and continuous procurement of a wide portfolio of vaccines. Nonetheless, SARS are continuously coordinating with LGUs to provide immediate response strategies to COVID-19 cases, and thus we are seeing more and more Filipinos recovering from COVID-19. The actions we implemented during the ECQ aim to institutionalize sustainable and long-term response strategies to prevent further surges of COVID-19 cases and ensure the country will no longer need to return to ECQ in the future. And we are asking for everyone's cooperation. Let us all work together in curbing the transmission of COVID-19. Let us remember the 3 factors are contributing to the surge: transmission rate, contact rate, and duration of infectiousness. We can and must reduce those 3 in our own ways by ensuring that, firstly, we strictly adhere to the public health standards and that we follow isolation and quarantine protocols when warranted. Your DOH is ensuring everyone that the government will also do its part in responding to the healthcare needs of our kababayan. Makakaasa po kayo na sa pagkakaisa ng iba't ibang ahensya ng gobyerno at ng DOH, malalabanan natin ang COVID-19.
Maraming salamat po to the Secretary of Health for updating us with the initiatives undertaken by the Department of Health nung nakaraang ECQ. For the next part of the media forum, Yusek, Fatima, can we flash the screen, please? Thank you.
Yes, I'll just give a more granular report dun sa mga sinabi ni Secretary kanina base dito sa mga ginagawa natin, especially in the National Capital Region. Can we have the slides now? Next slide, please. So currently nasa MECQ tayo, yung lugar ng Bulacan, Laguna, Cavite, Rizal at NCR. Buhat nung nakita nating tumataas na yung mga kaso, nirekomenda na ng IATF against COVID-19 at iba pang mga sektor na mapanatili natin ang MECQ dito sa NCR plus bubble hanggang sa end of April so that we can prevent the further spread of the cases. Gayun din sa pamamagitan ng MECQ, ating mapapalawig yung capacity ng ating health system so that we can be able to address the current needs of our citizens right now for health services. Next slide, please. Nagkaroon po ng meeting sila Secretary Duque, Treatment Czar Yusek Leopoldo Vega, at iba pa hong miyembro ng DOH Executive Committee kasamang officials ng National Center for Mental Health upang mabuksan na po natin at makapagtanggap na tayo ng COVID-19 patients sa National Capital Region. Ang National Center for Mental Health ay magiging isang itinalagang COVID-19 facility kung saan meron po tayong aabot sa 1,000 kama para sa ating mga moderate cases ng COVID-19. May karagdagang mga kama rin sa iba't ibang ospital sa iba't ibang bahagi ng National Capital Region. We have modular hospitals, 44 beds in Tala Hospital, 44 beds in the Lung Center of the Philippines, 110 beds at the Quezon Institute Off-Site Modular Hospital. We also have modular tents and beds where we have 5 tents with 34 beds in Tondo Medical Center. We have 7 tents with 39 beds at Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium. We have 4 tents at the San Lazaro Hospital, 3 tents with 24 beds at Jose Fabella Memorial Hospital, 3 tents with 45 beds at the Amang Rodriguez Memorial Medical Center, 2 tents with 12 beds at Las Piñas General Hospital, 5 tents with 100 beds at the Jose Reyes Memorial Medical Center, and 2 beds with 28 beds, 2 tents with 28 beds at the Lung Center of the Philippines. So ito po lahat yung mga nagawa natin as additional for the number of beds that we need for this current situation that we have. Next slide, please. Dinagdagan din po natin yung bilang ng ating mga healthcare workers para matugunan natin ang pangangailangan ng ating mga ospital so that we can appropriately provide the services that are needed by our patients. Binisita po ng ating secretary ang Jose Reyes Memorial Medical Center, ang Lung Center of the Philippines, ang National Kidney and Transplant Institute upang kamustahin at kausapin ang mga healthcare workers mula sa mga regions ng Visayas at Mindanao na na-deploy po dito sa ating mga ospital. Sa tulong ng ating mga regional offices sa Visayas at Mindanao, tayo po ay nakapag-deploy ng 136 healthcare workers dito po sa National Capital Region. Ang mga dagdag nating kasangga mula po sa ibang regions ay makakatulong po dito po sa current cadres natin in the National Capital Region. So tuloy-tuloy po ang ating deployment, tuloy-tuloy po ang paghahanap natin at pag-hire ng additional healthcare workers para po matulungan natin ang ating mga healthcare workers dito sa Metro Manila. Next slide, please. So dama po natin ang takot at pangamba ng ating mga healthcare workers, and we like to just emphasize that we recognize the value of our healthcare workers. Alam po natin kung gaano sila kaimportante, lalong-lalo na po nung nag-umpisa at hanggang ngayon ang pandemya. So sinisigurado po ng Department of Health ang kanilang mga benepisyo at mga sweldo ay maibigay sa kanila on time and completely. So pinapabilis din po natin ang pagbibigay ng ating Active Hazard Duty Pay or AHDP at Special Risk Allowance or SRA. So makikita nyo ho dito sa slide kung magkano na po ang naibigay natin at na-download sa ating mga ospital how much we have allocated for the different benefits of our healthcare workers. Next slide, please. Binisita din po ni Secretary Duque at ng mga opisyal ng USAID ang Caloocan City kahapon. Ang Caloocan City po ay mayroong 12 vaccination sites at nakakapagbakuna po sila ng 3,600 individuals per day. Inaasahan din po natin na sa pagdating ng karagdagang mga bakuna, tataas pa rin po ang mga taong nababakunahan sa ating mga syudad dito sa Metro Manila. Nagpapasalamat din po ang DOH sa USAID sa pagbibigay ng donation of 170 million pesos upang matulungan po ang COVID-19 vaccine deployment program natin. Inaanyayahan po natin na lahat po sana ay magpabakuna. Nakikita po natin ang mga efforts na binibigay ng ating mga different cities ng ating iba't ibang mga lugar sa Pilipinas para lang ho mapabilis natin ang pagbabakuna sa ating mga kababayan. Next slide please. Panghuli po sa lahat, tayo ay patuloy na nakikipag-ugnayan sa iba't ibang ahensya ng gobyerno, mga medical organizations, private sector at iba pa upang magkaroon tayo ng pagpapalawak ng ating mga aksyon kontra COVID-19. Tayo po ay nakikipagpulong halos araw-araw sa ating mga hospital chiefs upang mabigyan po natin ng tugon ang kanilang pangangailangan and of course, para ma-direct din po natin sila at makapagbigay ng technical assistance if needed para sa ating mga ospital. Kasama po sa pakikipag-usap namin ay ang ating private sector hospitals para po maging iisa lang ang ating mga strategiya na ipapatupad at lalo ho natin mapabilis ang pag-decongest ng ating mga ospital. Kasama rin po dito sa pakikipag-usap natin sa kanila ay ang expansion ng debit-credit payment mechanism sa pakikipag-ugnayan po ng PhilHealth. Ang lahat po ng ating sinasagawa ay atin pong regular na inuulat sa ating Pangulo every week upang mabigyan naman po siya ng karampatang updates and the public para mabigyan niya rin po ng information sa publiko ang mga ginagawa nating aksyon laban sa COVID-19. So yun lang po at maraming salamat. Nick?
Thank you po, Yusek, for the presentation. We can now proceed po with the questions that were submitted yesterday. Ma'am, for the first question po from Caroline Mungkin of CNN Philippines. Can the DOH explain po bakit kailangan maghintay ng 90 days bago makapagbigay ng convalescence plasma ang nakarecover ng COVID-19? And bakit po pwede na agad makakuha ng bakuna ang tao immediately pagkagaling? Ano po ang science behind this?
Okay, yes, Caroline. No? So unang-una, kung matatandaan nyo, ang una nating binigay na protocol was for us to wait 90 days bago po tayo magbakuna kung tayo ay nagkasakit. But later on, pinalitan po natin dahil ayon dun po sa mga ebidensya at pag-uusap-usap ng ating mga eksperto, sinabi naman nila, no? And based from CDC, based from WHO, wala namang problemang bigyan ng bakuna ng COVID-19 ang mga taong nagkaroon na ng bakuna or nagkaroon ng COVID-19 infections in the past. Wala ring sinabi ang WHO at saka CDC ng period of time that you have to wait before you get vaccinated. Ang mga eksperto natin nung tayo ay nagbigay nung paon ng 90 days ay para lang magkaroon unang-una ng strategy dahil alam natin kulang po yung ating mga supply of resources, no? So our experts, the NITAG, thought it best to recommend na since those people who has recovered from the infection still have their antibodies with them, so it would be prudent na pwede namang ma-delay ang kanilang pagbabakuna at mauna na muna ang iba. Pangalawa, ang sinasabi nga, kaya nilagyan natin ng ganyang kahaba na 90 days dati na interval, no? Even for those who have convalescent plasma at saka yung mga monoclonal, ito po yung gusto lang natin masiguro at ma-focus anong antibody yung nag-work sa'yo. Was it the vaccine? Was it the monoclonal antibody na tinake mo o yung convalescent plasma? So all of these were part of the discussions of the experts. But later on, because of this surge or this increase in the number of cases, especially in specific areas of the country, we thought it best, the experts have recommended that let's remove the 90 days, let's have everybody eligible vaccinated at once so that they can get the protection. Kaya po nagbago tayo ng ating, inamend natin yung ating policy binago po natin na sinabi natin, immediately after you recover, you can already receive your COVID-19 vaccine. But for those who have received convalescent plasma at saka yung monoclonal antibody, yung 90 days po ay i-retain natin sa policy na yan. Nick?
We hope that's clear po, no, from Caroline. Next question po, Yusek. May sumulat daw po kay Secretary Duque na nakakonfine sa Quezon Institute Modular Hospital. Ang sabi, wala raw pong doktor na bumibisita sa kanila. Wala rin daw pong gamot. Nagsiself-medicate sila at walang binibigay na basic necessities. Nakaabot na po ba ito sa Department of Health? Bakit po kaya ganito ang experience ng iba sa QI?
Yes, no? So kahapon, as soon as we received this report, we called on Dr. Montaña. He is the medical center chief of Jose Reyes Memorial Medical Center. And as you all know, ang QI po ay extension facility ng Jose Reyes. So he said he's going to investigate and will be providing us the report. So antayin po natin yan at magbibigay tayo ng impormasyon. And siguro the statement also will be coming from our medical center chief.
Thank you, ma'am. Next question po from the Manila Times. Ano daw po ang status ng mga vials na AstraZeneca vaccines doon sa Provincial Health Office ng Cagayan de Oro City? Are we considering that these vaccines are already wasted vaccines?
Most probably, no? Dahil nagkaroon ng sunog, temperature was high, so hindi na ho natin i-risk na tignan pa at gamitin ang bakuna dahil nabago na po yung temperatura kung sakali. Not unless that the storage of the vaccines or yung ref nila ay malayo dun sa pinangyarihan ng sunog. But anyway, investigation is being done kung ano po yung nangyari talaga at saka ano yung status ng mga bakuna. But most probably, this will be considered wastage already. So ito pong mga bakunang ito po yung mga natira dun sa mga pagbabakuna nila, and as the report said, these are 30 vials, no, equating to 300 individuals. Ito pong mga ganito pong nangyayari, these are accidents, no? Wala naman hong nag-will para gawin mangyari yan, ano? So ito namang ating immunization program, kaya lagi kaming may nakatalaga na wastage provision. Meron ho kami laging sa computation ng mga pangangailangan natin ng bakuna, nilalagyan po natin talaga ng buffer for wastage yan. So ito po ay hindi makakaapekto sa ating bakunahan or immunization program.
Yusek, from the question of Greg po yesterday, ano daw po ang reaction ng DOH to some LGUs who have halted registration for vaccination due to scarce supply of vaccines? But Yusek, correction po from Greg, booking daw po for vaccination ang nasuspend and not the registration itself. Yusek?
Tama yun, no, Greg? Wala hong nagpapatigil ng pagbabakuna ngayon. Tuloy-tuloy po ang ating mga local governments. Ang ginawa lang po nila, ginawa nilang more organized, no? Kasi ang nangyayari po dati, pag kami walk-in, nagkakaroon ng maraming tao sa vaccination sites, and that is something which is very risky for the citizens who are having their vaccination and for our healthcare workers who are giving the vaccination. So inayos lang po ng ating mga local government, and I think this is more rational na organized po talaga na by schedule na para we can prevent also yung crowding dito sa ating vaccination sites.
Thank you, ma'am. From Lay Alvis of GMA News, ilan na daw po ang deaths sa AFIS? May we ask for the demographic information and other pertinent details ng causality investigation?
We will be providing this in our regular weekly reports, no? Ang atin pong mga adverse events ay ire-report natin weekly. Yun naman po ang aming sinabi. Mahirap po tayo magbigay ng araw-araw na numero kasi minsan na-validate namin and then we find that hindi pala siya talaga kasama dun sa adverse events ng pagbabakuna. So we give it to you every week para po hindi nagkakagulo ang numbers natin. I just like to clarify, no, sa ating mga kababayan. May lumabas kasing social media card kagabi na sinasabi ko that we have this much adverse events. Kailangan po natin maintindihan na kapag bigay tayo ng numero ng adverse events, let's say it's 26,000, ang sinabi ko dyan, ang porsyento po nung serious dyan ay napakaliit. Kapag tinignan naman ho natin yung kabuuan na 26,000 out of the 1-point-something million that we already have vaccinated, napakaliit din po niyan. And pangalawa, gusto ko lang hong ipaliwanag sa ating mga kababayan ang pagbabakuna po, meron ho talagang mga ganitong adverse events, no? Yung sinasabi nating side effect. Para pong kapag binabakunahan natin ang ating mga anak, kapag sinabi ng pediatrician, maglalagnat yan, magiging irritable, baka ayaw mo nang magdede o sumuso, pero pagkatapos mawawala din. And that is really because the vaccine is working for you dyan sa inyong katawan, kaya nakakaramdam tayo ng mga ganitong simptomas. Napakaliit po ng porsyento ng mga nagkakaroon naman ng mga serious side effects. Nick?
Thank you, ma'am. Next question po. The research suggests 14-day continuous quarantine regardless of test result. Kung i-release daw po kasi on the 5th or 6th day sa LGU, baka magkaroon ng gap para sa hawaan kung may false negative.
Unang-una, ginagawa naman po na namin yan. Simulat sa pool ng ating pandemya, we have these omnibus guidelines which states that no matter what your results are, kailangan magtutuloy ka ng quarantine ng 14 days. Hindi po yan nawala sa ating mga ipinapatupad ng ating gobyerno. Nag-re-strategize lang tayo. Kailangan maintindihan ng ating mga kababayan, ang ating pong resources, hindi po siya infinite ba tawag doon? Hindi siya marami. Okay? Pangalawa, kailangan din po natin maintindihan na yun pong ating mga kababayan na mga OFWs or mga returning overseas Filipinos, they also would want na makauwi na rin sila sa kanilang probinsya. The safeguard would be that local governments has to complete their 14-day quarantine. Halimbawa po, nakalabas sila ng 7th day from the national level dito po sa mga quarantine hotels dahil nag-negative na sila sa result. Pagbalik po dun sa kanilang mga local governments, sila po ay ka-quarantine. Kausap po natin ang local governments dito and actually they are much stricter than the national government. They would want another test when the returning overseas Filipino or our kababayans ay papasok sa kanilang lugar. So hindi po natin panapabayaan na magkaroon ng break dito sa ating mga 14 days quarantine period. Lalong-lalo na po ngayon na tumaas ang kaso, talagang tayo po ay nagbigay ng request at saka ng guidance sa ating DILG at sa ating OWA at saka sa ating DOTR na nag-handle ng one-stop shop na strict talaga tayo ngayon do sa 14 days quarantine ng ating mga kababayan, whatever the results are.
Thank you, ma'am. Next question po. Pwede pa rin daw po ba magpabakuna ang mga uminom na ivermectin and ano po ang mga precautions?
Yes, wala pong problema kung uminom ka ng ivermectin. Kailangan kung ikaw ay scheduled for vaccination, have your vaccination. Gusto ko lang ipaalala uli na ang ivermectin po, hindi pa ho natin nire-recommenda para po sa mga treatment ng ating COVID-19. Base po sa mga pag-aaral, ganun pa rin ho ang lumalabas na wala po siyang ibinibigay na positive effect sa ating katawan kung tayo ay may COVID-19. So gusto ko lang hong bigyan ng emphasis ito para sa ating mga kababayan. Go and get your vaccine even you're taking any of these drugs.
Thank you, ma'am. From Caroline Bonkin, ano daw po ang case fatality rate po sa NCR and ano daw po ang formula for the CFR?
As of April 15, ang ating case fatality rate sa NCR is 1.46%. We compute the case fatality rate based on the number of deaths from this specific disease, yung COVID-19, over the number of confirmed cases. So ganun natin po siya ginagawa ng estimation and that is based from our epidemiology concepts. So ganyan po tayo mag-compute.
Thank you, Sec. Ma'am, I'll be proceeding to the questions that were sent in the chat po. The first question, still from Caroline, ano daw po ang basis ng new A4 priority list and timetable po kung kailan sila babakunahan?
The basis of the A4 list would be based from the studies of the National Economic and Development Authority. So una, tinignan nila ano yung bakit essential itong mga workers na to. That's the first. How they interact with clients, what would be the statistics based from the records ng mga nagkakasakit because they are directly interacting with people. Pangalawa, ano yung contribution din niya sa economics natin? Kaya nga natin siya tinawag na essential Kasi hindi pwedeng mawala sila at maitigil muna ang trabaho nila. Tuloy-tuloy sila kahit may pandemya. You see the grocery sales lady, yung mga cashier, yung sa commuter transport sector, kahit po nag-i-ECQ tayo, nagtatrabaho pa rin po sila. That's why we identify them as essential. Ngayon po, itong ating schedules for this, pati specific guidelines, aayusin pa ho natin ito. Ito pong binigay na listahan na ito kung paano natin gagawin at saka kung kailan po mangyayari. Pero ang sinasabi naman po kasi na Secretary Galvez, as soon as the stocks of vaccines will come in na regular na, stable ang ating supplies, magsa-simultaneous na rin po tayo hanggang A4 of our population. So antayin lang po natin ang announcement ni na Secretary Galvez as to when we can start the A4 depending on the supplies of the country.
Thank you, ma'am. Ma'am, I'll accommodate 3 more questions po. I know you have an engagement at 10 a.m. Next question po from Christian Manny of DCRH News. Philippines has asked the US if it could borrow from its stockpile of AstraZeneca, according to the Philippine ambassador to the US. Can you confirm this po? And ano daw po ang possibility nito? And any updates or developments regarding this?
I do not have any updates on this matter, no? So maybe Secretary Galvez can give us that information.
Thank you, ma'am. From Red Mendoza, how can we be assured na hindi magkakaroon ng issue sa infection sa mga medical tents natin as opposed sa mga modular facilities?
It's the same setup. Pag naglalagay po tayo ng tents o kaya mga modular hospitals, meron po tayong standards na sinusunod, no, for infection prevention and control. At yan naman po ay pinapatupad natin sa ating mga modular hospitals and even the tents. So pareho lang po ang mga setup na mga yan. Kailangan lahat ng components para makapag-function well ay naandon. Aside from the components of beds, equipments, medicines, healthcare workers, kailangan may standards po para sa infection prevention and control. At chine-check po natin maigi ito dahil ayaw po natin na nagkakahawa-hawaan sa mga ganitong lugar.
Thank you, ma'am. From Aiko Miguel of UNTV, may update na po ba sa administration na AstraZeneca vaccines? May lumabas na po bang recommendation na magbigay ng 3rd dose after a year of inoculation?
Wala pang mga ganyang rekomendasyon Aiko, no? So lahat yan pinag-uusapan at pinag-aaralan pa rin. Katulad ng lagi sinasabi ko sa inyo before, may mga kaunting studies na nagsasabi that the duration of immunity from specific vaccines would last for 6 months. Yung iba naman sinasabi 12 months. So antayin natin lahat yung information na yan bago tayo makapagbigay ng rekomendasyon.
Thank you, ma'am. From Red Mendoza, saan din po pala ibibigay yung mga initial supplies ng 500k vaccines from Gamaleya? Would this be prioritized sa NCR unlike yung 500 na binigay na Sinovac last Sunday na dineploy sa Visayas and Mindanao?
Pinag-uusapan pa to ngayon ng vaccine cluster and of course yung ating National Immunization Technical Advisory Group. So tinitignan namin ngayon kung ano na yung coverage natin dito sa National Capital Region and the surrounding provinces na kasama sa bubble. Bibigyan natin ng rekomendasyon ng vaccine cluster on how we can go about with allocation by next week.
Thank you, ma'am. For the last question this morning from Christian Manyo, Pfizer says 3rd COVID-19 vaccine dose is likely needed in order to maintain protection against the virus and its variants. Do we have comments po regarding this? And hindi po ba tayo napaghuhulihan considering majority of the Filipinos ay hindi pa po napapakunahan?
Katulad ng sabi natin, we need sufficient evidence to say if additional doses are required, if booster doses are required for any type of vaccine. So kailangan ho nating ipunin muna lahat ng ebidensya, kailangan natin ng rekomendasyon galing sa WHO and maybe the reputable institutions abroad ay makitaan natin ng ganyang rekomendasyon. Until we can have this complete information and evidence, we are going to do the status quo. No? Magbabakuna tayo na magbabakuna, pabibilisin natin ang ating pagbabakuna, i-expand natin siya. Actually, we have already identified big vaccination sites para ma-scale up natin ang pagbabakuna at bumilis talaga at makapunta ang ating mga kababayan. So katulad ng sabi ko ng isang araw na yung Pilipino, meron na rin in the pinag-uusapan with the private sector para ma-expand ang ating vaccination sites. So itong mga susunod na linggo, the scaling up of the vaccinations, makikita natin mangyayari na yan para mas ma-cover natin na mas maraming kababayan natin dito sa ating bansa.
Thank you, Yusek. Those are all the questions we can accommodate for today. Ma'am, your final message po before we end today's forum.
Yes, thank you. And sorry po, kailangan namin putulin ito. I have an important meeting at 10. But for the other questions, our team will be sending you through our Viber group. So I just like to thank all of you again. Maraming salamat po. And sana po tuloy-tuloy pa rin tayo magtulong-tulong to give the tamang impormasyon sa ating mga kababayan, lalong-lalo na po ngayon na medyo critical po ang ating sitwasyon. So gusto ko lang magpaalala sa ating mga kababayan, tuloy-tuloy po tayong to comply with the health protocols. Lagi po tayo magsusuot ng mask at face shield, do the physical distancing. Huwag kayong pupunta sa mga lugar na sobrang dami ng tao o masyadong matao at hindi kayo makakapag-physical distance. Make sure that you are in a well-ventilated place kung sakasakaling kayo ay kailangan pumunta sa isang lugar. At lagi pong uugaliin na makinig lang sa tama na impormasyon. Doon lang po sa tamang sources of information kayo kumuha para hindi po tayo nagkakaroon ng misinformation. At sana po makakausap nyo rin ang inyong mga kapitbahay at mga kamag-anak if nakikita nyo po na maling impormasyon po ang kumakalat sa inyong komunidad. Maraming salamat po sa inyong lahat and happy weekend to all of you. Thank you, Nick.
Thank you, ma'am.